Hi everybody, and I'd like to welcome you to another show today of CommonSenseHD.com, the TV show. And I want to remind you about CommonSenseHD.com, the website, where you can gain all kinds of interesting information. And then as well, I have the YouTube sites, which were CommonSenseHD.com, the YouTube, and then CommonSenseHD1.com. YouTube. And so you can see some of the shows played on either one of those YouTube sites. And as well, I have a special guest that I think my mom will really enjoy. I have today Margaret Henederson, who's a nurse. And what we're going to do today is we're going to talk about nursing and something about what nurses are and who nurses take care of. And so I'm going to start with myself. I've been a nurse for quite a while. I'm not going to tell you how long. I'm a nurse practitioner, and I got my original bachelor's degree in nursing from the University of Massachusetts in Amherst. I went on to get my master's degree at the Medical College of Virginia, Virginia Commonwealth University in Richmond, Virginia. And then I got 80 credits towards a PhD or doctorate in nursing at the University of Texas, Austin, Texas. Hook 'em horns. And hope you guys have a winning season. I know you already had one game, and I don't know what you did with it yet, but I'm going to find out tonight. I've been a nurse in a number of different venues. I've worked as a bedside nurse in a medical surgical unit. I've worked as a trauma nurse in a large emergency room. I worked in I did organ transplant for quite a bit of my career, doing heart, liver, and kidney organ transplant. I worked in a number of ICUs throughout the eastern seaboard, and I worked as a family nurse practitioner, and now I work as a nurse in a correctional institution. So I've had sort of a varied background. I've really enjoyed the nursing experience, and probably have enjoyed the nurse practitioner role and the correctional nursing the most. And there's a number of different reasons why. And a lot of people would say, well, why the correctional nursing? You know, a lot of people do a lot of bad things, but some people do bad things and had a bad life. And so some of them you have to, you know, a little leeway. Some of them not so much leeway. But and then I really enjoyed the family nurse practitioner role because I get to meet so many different people. I took care of newborns. I actually got to assist with a birth in a rural health clinic, which is an exciting experience. And took care of a woman that was 102 in Mississippi who had been a slave when she was a child. And she talked all about what it was like and how many different things had changed and how her perception had changed of people. And just, I couldn't even tell you how many different things that she talked about in just small bits of time. Because she was very healthy. She wasn't coming because she needed to come. She was coming because in the rural area that I worked in, that's what family members did sometimes. They would just come and visit us. And I worked with a wonderful physician, Bill Touchstone, and he was from Mississippi, and he had never really left the state. And he, you know, he traveled quite a bit, but as a professional career, he was, most of it was in Mississippi. So he knew quite a few people, because when I was in Mississippi, there was less than 1 million in the state. So it's pretty small in population compared to the size of the area. We had about 2,500 people in a community, a county that was probably, well, 2,500 were in the county seat, and there was about 10,000 in the county, and the county was probably about the size of 4 Burlingtons, 5 Burlingtons. So that was pretty spread out. You had a lot of space between people. And so people would just come and visit. They would bring little gifts. They maybe had baked or whatever. And so they would bring us brownies or cookies or whatever. And it was nice. It was fun. And so then they would sit and talk for a few minutes.
Just have it in it. Okay.
Shh. We have a new camera person today. John is his name, and he's learning how to function and operate a studio camera. So that's, it's part of the sort of the quaintness of the show. But I would like to introduce my guest, and I hope you'll give her a very warm welcome. She's very nervous, and I had to talk her into and use the nurse bit on her to get her to appear. But I think she's going to be a very interesting guest, and that's Margaret Henederson.
Thank you for inviting me. Yes, my name is Margaret Henederson, and my nursing career started in St. Louis, Missouri, where I achieved an associate degree. Came here to Massachusetts in 1969, received a bachelor's in nursing, and worked from 69 to 77 at the old Boston City Hospital. I left Boston City and went to work for the Veterans Administration in Boston, and my career finally came to where I was a nurse at the Edith North Rogers VA Hospital in Bedford, Massachusetts. After receiving my bachelor's of nursing, I received my master's degree at the Teachers College at Columbia University. And from there, the Veterans Administration sent me to Fort Wayne, Indiana, where I directed a nursing home at Fort Wayne, Indiana for the VA. From 1984 until I retired a month ago, I worked at the Edith North Rogers VA Hospital, and as an associate chief nurse and chief of community-based program. And in this role, I established programs for the veterans. Now, let me just say that I retired on August 2nd, but during my work for the VA, I enjoyed working with the veterans, and I worked in mental health where we had to design programs and work closely with the veterans. And the veterans were someone who really appreciated the help that nursing could give. And so as I come to an end of my official career, I absolutely want to say that I absolutely enjoyed working with the veterans.
Well, we were talking earlier before you, consented to appear about how many of the correlations there were between the correctional population, especially in the community or county systems. I think probably more so than in the state system, because the county, they're there for larceny or under 200. They're stealing to live, and a lot of them are homeless, and they're dealing with the post-traumatic stress disorder, and they're dealing with drug issues and alcohol issues and a lot of other health issues, a lot of psychiatric issues relative to their service in the military. And so that's a really sort of big thing that you were doing with providing community service to that population, because it's hard to find them sometimes.
Oh, yes, and the Veterans Administration has established a domiciliary for people who wanted to come in and work on their illness, PTSD or alcoholism, drugs. And they may go to the domiciliary and stay for a while, and then from there they go into the community and begin to live in the community. It's nice to have programs all over Massachusetts for our veterans because we are beginning to see our veterans return from the war, and many of them have issues that they want to work on, PTSD as well as others.
Right. I know we have veteran services in the prison. We have 2 gentlemen that work in the prison doing veteran services and trying to identify a lot of the prisoners, identify veterans within the prisoner population. Because a lot of times when they first come in, they're not capable of sort of comprehending what's going on because of their drug issues and their alcohol issues and a number of other issues. And so that they are able to get services when they're in the prison that they necessarily wouldn't have gotten because they're out on the street and they're sort of lost to the to everybody, society and everybody else. I mean, I remember, I can't remember the exact name of the movie, but it was about the veterans when they returned, they hadn't yet come home. And because they hadn't, see, I told you, they hadn't reconnected with society yet because, they, you know, Homecoming, was that the name of the, I think that was the name of the movie. And all the issues that they dealt with in the sense of the separation of their social lives from, you know, everybody says, well, geographically you're home, but they weren't home. And I know that a lot of the veterans in the prison system are dealing with that issue. And it's, you know, really interesting to hear that you have services in that direction. Where was your alma mater? Where did you get your bachelor's degree?
The bachelor's degree I received at the old Boston State.
Oh, yeah.
And it's now UMass Boston, but it was the old Boston State. And I was working full-time as well as
Well,
attending
you
school.
had proximity at least there.
Yes.
They were close together.
Yes.
And so where did you get your associate's degree?
The associate's degree I got in St. Louis, Missouri, where I came from originally, and it was at Forest Park Community College, which still exists.
Oh, see?
Yes.
Go Forest Park!
And I just want to say that since I became a nurse, I received a great deal of satisfaction because this has helped attract others into nursing.
Well, do you mind telling me the story about your first position at Boston City?
Well, I was telling you earlier, my first position at Boston City was a nurse manager, and this was in 1969, and at that time you saw very few blacks as nurses. And I went into a meeting, and I can remember this very clearly because I went into a meeting and I was the only black in this particular meeting in a leadership position, nurse manager. And I felt uncomfortable, felt really uncomfortable. And there was a student from Denmark, Bjarne Højbjerg, who came over and reached out his hand and said, "Hello, I'm Bjarne Højbjerg, welcome." And that was very helpful. And you need to know he was working toward a psychology, but as a friend, we developed friendship that has lasted 40-some years.
Wow.
Still a friend.
Right, and that's one of the things that happens, and maybe you don't get, like I know with patients, you don't necessarily get back together again with them, but I've had patients who've come and said, "Oh, I know you."
Yeah.
And I'm like, well, but it was 10 years ago that I took care of them. And they're like, "I remember you almost every day." And because if it hadn't been for you, I wouldn't be alive or whatever. And it, you know, that's, I won't put it on you, but I know the old thing that I was told is nurses care for 24 hours, a doctor only cares for about 5 minutes, you know, and so maybe they come in the critical 5 minutes, but they, you know, a lot of the nursing care is over a period, you know, health care is over a 24-hour period. And so it's the nurse that's there seeing the monitoring for the changes that sort of illustrate when a patient is headed toward